Sabrina and Jason, the hospital makes it clear that part of bringing stability to the flatlining finances is doing away with exorbitant physician contracts that were approved in the past.
Better in the sense that we are discovering excesses that we can control, and there are some excesses that we cannot control, but we're finding other means to help us in that situation.
Guam Memorial Hospital Chief Financial Officer Sila Karupin is optimistic that the once flatlining finances at GMH are well on the road to recovery. The new management team put in place by Governor Eddie Calvo has been looking at each department in the hospital and looking at what expenses can be cut without jeopardizing patient care or safety. One area that's undergoing significant review is physician contracts.
We are looking at every contract that we have with every physician to ensure that the hospital at least captures those charges that we have laid out.
But practices of the past weren't recovering a single penny for what the hospital was paying out. For example, a neurosurgeon was brought on board to work 20 days out of the month on Guam for $400,000 a year. KUAM confirms this physician only performed 8 surgeries in 2009. That breaks down to about $50,000 apiece. Last year, the neurosurgeon only did a single surgery for the entire year, despite receiving the full $400,000 he's contracted to get. Karupin admits GMH is losing out big time.
As it currently stands, we lose technically $400,000 a year because we do not bill for his services. So we're trying to change that and see if there is a possibility of us renegotiating the contract and billing for the services to recapture the cost that we are laying out for this physician.
GMH is also losing out on another $180,000 a year since the previous management made the decision to hire a second neurosurgeon to work the remaining 10 days out of the month that the other doesn't work. Meanwhile, another hospital surgeon was brought on contract with GMH in May of 2006 for $250,000 a year, but in 2008 he was hired locally, but his salary ballooned to $375,000 a year. Karupin confirms that contract is also under review. Then there's the issue of some physicians demanding that patients, even some with insurance, pay cash up front before a service is provided. Even though the doctor is being paid by GMH, some have been charging patients directly for the services, essentially being paid since they receive a paycheck through GMH directly whether they work or not, then billing patients for the services they were hired to do.
There are contracts that has those provisions currently that we are looking at.
Is that something that this new management team is looking at, stopping that provision?
Yes. The way to stop that provision is either to decide whether to keep that service or to terminate that service. If we decide to keep that service, we want to ensure that the hospital bills for those services. This way, we would recapture the costs that
you all are paying out.
They incurred, yes.
Additional cost-cutting measures that have been proposed include the closure of the hemodialysis unit that has resulted in the hospital losing more than $1 million each year. The new management is also working to outsource transcription services to a Philippine-based company that could save $12,000 a month, as well as hiring full-time ultrasound technicians and dietitians.